Start recording. Okay.
Welcome, everyone, and thank you for joining us for today's Survive and Thrive presentation, Managing Stress After Cancer, presented by Dr. Mary Moeller.
Thank you.
Mary is a clinical health psychologist and has been with the Taussig Cancer Institute of the Cleveland Clinic since 2022. My name is Stephanie Feiger, and I am one of the licensed social workers on our team. I've been with the Institute since 2023.
All right, let's jump right in here. Um, so my notes are on a separate screen from my camera. So if I'm looking off to the side and not making eye contact with you as the viewer, that's why I'm not ignoring you. Um, so these are kind of just an overview of the topics we're going to hit on today. We're going to define what stress is, how it relates to cancer and the impact it can have on cancer, and then what are some of the different ways to cope with stress. So we'll talk about some immediate stressors and some more long-term ones and ways to cope with those. And these are just a few of the many common concerns I hear a lot about as a clinical psychologist working with cancer patients. So I see patients and survivors every single day, and the vast majority of them have at least one of these concerns. So we'll talk about each of them separately and then give an overview of ways to address them. So I wanted to start by just all getting on the same page about what is stress. The World Health Organization defines it as a state of worry or mental tension caused by a difficult situation. And I really like that term mental tension because I think we feel that tension in our minds and in our bodies when we're stressed out. Um, and it can present acutely, so just more short term, day to day, or more chronically. So with the acute symptoms are the ones that we kind of have a stereotype about in our head where we worry, we feel on edge. There's kind of that fight or flight or freeze response. It's what we do in the moment. Um, and we're not typically too concerned about those as mental health professionals, because that stress in the acute form is it's valid, it makes sense to have, and it's what our bodies are made to feel. So we'll kind of talk about that toward the end of the presentation. But it's when that stress becomes more chronic that we want to think about ways to address it. Um, so chronic meaning we feel it for a very long period of time. See. So these are just some brief symptoms straight from the Cleveland Clinic's website about physical symptoms of stress and emotional and mental symptoms of stress. And these are more of the symptoms you might notice chronically too. So if you're feeling constantly exhausted or depressed or irritable, um, having panic attacks, having a lot of muscle tension, those are signs that you might be more chronically stressed out. So one common concern I hear about is I feel way more stressed now than when I had cancer. What some people notice is that after cancer, they don't feel like they can tolerate stress as well as they used to. Things that used to not phase them at all suddenly give them anxiety. And there's a few reasons for that. So a big one is our stress threshold. Just like this glass of water, our ability to cope with stressors is finite. It's limited. We have a limit to it. Cancer itself is a really stressful event. So cancer can fill up our stress threshold like water filling a glass and make it really high so that if even a small stressor that wouldn't normally phase us can make it feel like we're overflowing. So maybe, before cancer, planning a birthday party for your kid didn't used to be like this big daunting task, but now even deciding on what cake to buy can push you over that stress threshold and feel overwhelming. Um, and to address this, we recommend using daily coping skills and self-care to give yourself more resources to manage stress. And in a little bit, we'll talk about more specifics, what those look like and what you can do. Um, the other thing that can make us feel more stressed now than when we had cancer is this idea of comfort zones. So when you're going through cancer treatments, your comfort zone can become really small by necessity. So maybe you're exhausted from treatment all the time, or you're immunocompromised, so you can't really get out of your house as much. And when you're done with treatments and trying to kind of get back into your life, you're leaving your comfort zone, right? If your comfort zone was your house or your couch or your bed, and you're suddenly trying to leave that, it's going to feel like you're leaving your comfort zone. And by definition, that's going to create some discomfort. If this sounds like you, um, I've got good news and bad news. The good news is that it's temporary, but the bad news is the only way out is through, right? You might have to do things that make you feel uncomfortable or distressed in small incremental steps, even. Um, but once they become more of that everyday part of your life again, the discomfort's going to fade rather quickly. So that level of stress from leaving your comfort zones is not typically very long term. Um, so the second big concern is, will being stressed make my cancer come back? And I hear that daily almost, because we all know that long-term stress can be really bad for our bodies, right? So I want to go over what the research says and kind of what our view of stress is from a psychological perspective. So overall, studies have found mixed results in terms of the relationship between stress and cancer. There are some studies that have found a link and some that haven't. And the ones that have may not have looked at the indirect variables specifically related to stress. So, when we're stressed, we're not sleeping as well. We're maybe going through the drive-through for food instead of cooking something nutritious. Um, we're more likely to drink and smoke and do other kind of immediate gratification things to help ourselves feel better. We're less likely to exercise because one symptom of stress from a mental perspective is feeling like you just have no time for everything. And when you do have time, you just want to sit and stare at the wall. You don't want to hop on the treadmill, right? So we know behaviorally all of those factors can contribute to cancer risk. What we haven't been able to prove at this point is that stress itself, when you take all of those into account, increases or decreases cancer risk. We haven't seen that. Um, and another thing to keep in mind is that your body is made to feel stress. So it's almost good for us on some level. We need a certain level of pressure and stress to function and to be motivated. The trick is figuring out the things that are most important to you and what's worth that level of stress, because anything important to you is going to come with some level of stress. Can you imagine loving your children or your partner without ever worrying about their safety? Or caring about your job without worrying that you'll make a mistake and mess something up? Stress by itself is not bad. It's a natural phenomenon that motivates us to care and to do better. It's just one tool that we can use, and we want to intervene when we have too much of it, right? So it's almost too much of a good thing. We need some level of stress, but everyone kind of has their ideal level that works best for them. And if we get above that level, that's when we need to take some action. So the third thing I hear a lot is that I should be able to feel normal, but I can't. And I'm sure some of you might have even had that thought that once cancer treatments are over, I just get to go back to normal and live my life. And some people maybe do. I think overall, others have a lot of difficulty with that for some very valid reasons. The first is that it can be almost impossible to get back to normal because a lot of cancer treatments will take months, years. For some people, it's the rest of their lives. Some people have permanent changes in their bodies, their minds, their lifestyles, their relationships. So getting back to normal becomes less likely. Um, and on top of all of that, your life kind of gets put on pause when you're going through a cancer treatment, right? But the rest of the world keeps spinning. So even if you're trying to get back to normal, it can feel more like playing catch up because things at your job didn't stop, or things at your kid's school didn't stop, or your mom's health was declining while you were worrying about yourself. So it's more playing catch up than getting back to normal. Um, and cancer can kind of become a layer of your identity, even if you don't want it to. So sometimes it's more helpful to imagine moving forward into a new normal rather than going back to the old normal. Um, and I fully acknowledge that this has positives and negatives, right? There are some things you lose along the way from that old normal, and there can be a lot of sadness, frustration, and grief there. Um, and then on the flip side, we can use it as an opportunity to choose what's most important to us to pick back up again. And you want to pick up the things that matter most first. And then I also like to talk about expectation setting because having realistic expectations is an important part of this process. I mean, imagine if a friend told you that they'd just gone through a cancer treatment plan and was frustrated that they weren't feeling completely recovered after 2 weeks. You'd probably look at them like they had two heads and let them know, like, hey, recovery can take time. You just need to be nice to yourself through this, things like that, right? Um, and the goal is to try to treat yourself the same way you would treat that friend. And it's often way easier to be nice to friends or even honestly total strangers than it is to be nice to ourselves. So you want to treat yourself as kindly with as much grace as you would treat that friend or that total stranger who you'd heard of going through this. I also like to talk about shoulds. Oftentimes, we have a lot of shoulds for ourselves just as humans, right? I shouldn't do this. I should do this. I should have done this instead. I shouldn't feel this way. I should be happier right now. And these shoulds can be really unhelpful, especially when they go against the reality of the situation. So telling myself I should feel normal does absolutely nothing to make me feel normal, right? All that does is make me feel bad and down on myself for the natural way I already feel. So that can almost stop us from getting to the acceptance stage of things because we're spending all of our energy wishing things were different instead. Like if you feel like you should be able to walk around the block and you're frustrated because you can't yet, it might prevent you from walking to the mailbox and back, right? You might be more discouraged. If I can't do this the full way I want to, I'm not going to do it at all, right? So when you're telling yourself should, the little therapy joke we have, and if you remember nothing else from this presentation, you'll remember this, is that you're shoulding all over yourself. So we don't want to do that. We want to be able to accept the reality of where we are right now and work within that reality to maximize our outcomes and our experience. Um, I also like to talk about ways to manage stress. So we've seen some of the sources of stress and our perceptions of things and how that can interact with cancer. And I want to talk about what we can do with it. So there are two main umbrellas for options for coping with stress. The first is to get rid of the things that are making you stressed. So those are things like quit your job, pass your kids off to their grandma, burn your house down so you don't have to clean it anymore, right? Easy peasy. Obviously, that's a joke to illustrate that getting rid of stressors is kind of the harder option of the two things we'll talk about. You can't always just take away your stress, um, especially when it's about things that are most important to us, right? So what do we do instead? And increasing work-life balance tends to be a big one. So I have, um, you can see I don't really like the phrase work-life balance because I don't know, it makes those two entities seem like the same size, right? When work is work and then life is everything else. It's our joys and our relationships and our responsibilities. So I think it's really hard to imagine those two being exactly equal all the time, but figuring out what level of balance is workable for you is important. Um, so this can be really tough, especially depending on your job. if you really love your job and get a lot of meaning out of it, you may want the scales to tip more toward work, right? If you're someone instead who works in order to afford to do the things they actually want to be doing, um, it's important to think about what boundaries you can set from work so that you have time to do the things you actually want to be doing. And I do want to talk on about that word boundaries really quickly because I think that word kind of gets thrown around a lot in like popular psychology and social media. Um, Boundaries is about your behaviors, not someone else's. So if your mom keeps asking about your cancer and you don't want to tell her, your boundary is not going to be, Mom, you can't ask about my cancer anymore. You don't get to control anyone else's behavior except your own, right? So a more effective boundary would be if you ask me about my cancer, I'm going to ignore the question or I'm going to hang up the phone. It's about your behavior. The hope is that she eventually gets the hint and stops asking, but your boundary is what you're going to do to keep yourself physically and emotionally safe. So it puts the responsibility for change on you because that's what's within your control. So the other big option for managing stress is to it's more internally focused and it's focused on adding on instead of taking away. So if none of the stressors in your life are removable, can we add things to your day or your week to help you give yourself more resources for coping? So one way to do that internally is to reframe the way you see stress. So are you stressed over how much laundry you have to do, for example? There may have been a time during the worst part of your cancer treatments where lifting a laundry basket would have been really difficult. So now you're able to do that, right? You're able to do laundry. You have the opportunity to do it, which I know sounds really cheesy, but I hear that being an effective reframe all the time. You know, people will say, I have to go grocery shopping, and 6 months ago, I wasn't allowed to go to the store because I was immunocompromised. And it's just so great to be able to do this chore again. Um, and that reframe can reduce the amount of stress we feel from that task. And we're also going to talk about utilizing coping mechanisms and doing more of what refuels you because the kind of reframing and the gratitude doesn't necessarily work for everything because I mean, let's be honest, some things just suck, right? We can't be grateful for everything in our lives. So that's when we utilize our coping skills and do more of what energizes us and makes us feel refueled. So this could be engaging in your hobbies, talking with your friends and family, taking a power nap, playing with your dog, whatever it is you enjoy. And I want to talk about these skills in a bit more detail since a lot of them are at the heart of stress management. Um, so some examples of immediate coping for stress, if you're feeling really stressed and overwhelmed, these are things you can do in the immediate moment. Grounding skills are I mean, that's a pretty wide range of things, but some examples of those that people might have heard of would be um, naming every color you see. So you'll look around the room and you name every single color that you see. Um, some people will do mental math. Some people will do a five senses exercise. That's a really popular one. So you name five things you can see, four you can feel, three you can hear, two you can smell, one you can taste. And that kind of grounds you and gets you back in your body. The goal of these grounding exercises is to make you feel more centered and kickstart the logic part of your brain so that you can then move on to an even more effective coping mechanism. So grounding you use immediately when your emotions are high, and it helps you kickstart the logic part of your brain because when our emotions are high, that part kind of shuts down for a bit. And then you figure out what you need to do to solve the problem or cope more long term. I also like to talk about the vasovagal response. So doing something to activate your vagus nerve. Some people have found that really helpful. One of my favorite ones is you can just hum and that stimulates your vagus nerve because it's kind of in the back of your throat, and that activates a calming effect on your body. Um, so if you're walking around outside feeling stressed or you're just in your house, you can just try humming and see if that can help calm you down a bit. Deep breathing is one that I think the vast majority of people have heard of. But when we talk about taking deep breaths, we want to do diaphragmatic or belly breathing specifically. So, what that looks like is if you place your hand on your belly, you want to breathe in deeply enough that your hand on your belly moves up and down, and you're not just breathing into your chest. The idea here is if you breathe really deeply like that, it gives your body as much oxygen as possible. It makes it as easy as possible for your heart to pump that oxygen everywhere in your body that it needs. And it kind of just slows down those physiological responses to stress. Your heart rate lowers. It can have a positive effect on blood pressure, things like that. So um, it's just a very physically relaxing exercise. And then I always like to talk about the TIP or TCPP skills because those are phenomenal for if you're experiencing a very strong emotion. Um, and doing all four of these things has been shown to be really effective for decreasing the like extremeness of that emotional experience. So it kind of just makes it more manageable. So the T stands for temperature. You want to splash some cold water on your face, hold an ice pack to your eyes or your cheeks, or you just basically want to get yourself cold. I know we're heading into winter in Ohio, so that's not going to be a hard ask. You can even just go stand outside in your front yard, right? Um, the I is for intense exercise. So engage in vigorous activity for a short duration. That's, do 20 jumping jacks, for example. If you're at a point physically where that's not possible for you, we kind of change it to the C, which just means change in scenery. So put yourself in a different environment, and that can look like whatever you need it to. If you're in your living room, go to your bedroom or your bathroom, just so you're in a different setting. If you're able to get out of the house, go to a park or um, a store or just drive around or something. So it's just physically putting yourself in a different environment with the idea that that will also put you in a different mental state. And then the P's kind of get paired together. So you can do these at the same time. Paced breathing. And again, that looks just like that diaphragmatic breathing we talked about. You can add counting, you can inhale and exhale to a count of 4, 6, 8, whatever works for you. And then you pair it with muscle relaxation. So what that looks like is you take all your muscle groups. A lot of people will start in their toes and work their way up, and you clench for a few seconds and then relax. And then you do that with your feet and then your calves and your thighs and so on until you've hit the top of your head. And that can really help you release that physical tension. Um, And then I wanted to give reframing a little bit more love here because that can be really effective and helpful. It just it's more of a longer term um, coping mechanism because you have to kind of keep reminding yourself to do it over time. So as you move into your new normal, you want to really think about what's most important to you. Stress is going to be present in your life, right? We're all humans. It's not an option to avoid stress entirely. But we really want to think about what makes the stress worth it. And that's this life compass, for example, the picture on here has a lot of big areas of things that most people report. At least one or two of these are worth some level of stress for them, right? Friends and family, work, self-care, intimate relationships, whatever it may be, those things tend to be worth some level of stress for most people. Um, so the idea is we're stressing ourselves out for a purpose. And there's a little thought exercise that I love, and I think I'll just tell you about. So it's called pen in hand. And basically, It's a thought exercise. Usually I'll do it in a therapy session. So I'll ask my patient if I can take a pen and stab them through the hand with it. And I'm sure you will not be surprised to hear most people's immediate response is, no, don't do that. I don't want that to happen. Um, which I totally get. Who wants to be stabbed in the hand for no reason? And then we reframe it and we add to it and say, in this hypothetical world, you know it to be true that if I were to stab you through the hand with this pen, it would end world hunger so that no one would ever starve again. Would you be willing to let me stab you through the hand in that case? And most people at that point will either say yes or they'll at least think about it a little more. And I'm sure it's pretty obvious what the difference is, right? In the first example, you're suffering for no reason at all. And then in the second example, your suffering feels like it has a greater purpose. The amount of pain that you would feel as a pen goes through your hand does not change at all between those scenarios, right? It's just whether the pain is worth it or not, what the purpose of that pain is. Um, and that's kind of the way we look with stress and how to reframe it is it's less how stressful is this going to be and more what about this thing I'm doing makes the stress worth it. And that's one of the most helpful reframes you can do for yourself. And that's a question to keep asking. So I want to talk about some stress and reducing habits, things you can do, just add to your day over the longer term. Um, to help give yourself more resources and reduce stress over time. And a lot of these are person dependent, right? What do you enjoy doing? Because like I love reading. So if I just made everyone who came to me for therapy read for 30 minutes a day, it's going to help some people, but it's going to stress other people out more because some people are not readers. And that's totally fair. If someone tried to make me go on a run to reduce my stress, I would be way more stressed out because I hate running. So it's very person specific. You think about what do you enjoy? This can be hobbies, this can be exercise, this can be watching movies, talking with friends and family, whatever gives you a little bit of a sense of passion, right? And then what would give you a sense of accomplishment? Because sometimes we just have to get things done. So even if you don't enjoy doing the dishes, would it give you a sense of accomplishment to have them done and have a clean kitchen? Maybe a clean kitchen would give you a little bit of joy, right? Um, So think of small, easy things that would start giving you that sense of accomplishment. If doing the dishes feels like too much or you don't have time to do all of them, just set a timer for 5 minutes and clean what you can in that 5 minutes, right? It's anything that gives you a sense of accomplishment. Going on a walk can be a really good one for everyone who's able. I know it's controversial in our current 30-degree weather, but there's some research that suggests even 10 minutes of walking is enough to improve our mood a bit thanks to those exercise endorphins. So if you can't go on a walk, can you do any kind of movement for 10 minutes to give yourself some of those endorphins? Um, and then gratitude, right? Looking at all of the things we're thankful for while acknowledging that there are probably going to be things we are absolutely not thankful for and would love to do without. Um, a lot of times this works really well right before bed. You know, you're just laying in bed thinking about your day and thinking about um, the things you are grateful for that day. See. And I want to talk too about self-care because I think that word, just like boundaries, gets thrown around a lot. And my favorite definition of it is anything that provides for your past, present, or future self. Um, there are some examples on the screen. There are many, many more, and I'm sure we all have some that we could share or think about. But the important thing is that these tasks are not meant to add to the laundry list of things you already have to do. You know, because if you're busy with work, with your own health, with family, whatever it may be, and I tell you, hey, go watch your favorite childhood movie, that's just going to be more annoying than helpful, right? You're going to be like, I'm going to have to not sleep so I can watch Beauty and the Beast, like that wouldn't make sense. Um, so you're not wanting to add to your laundry list of things, but rather find things that fit into your life or would be helpful. So I love the idea of like chopping up veggies or like making a big pot of rice or quinoa so that you can have a nutritious lunch for the week, right? Things like that. I mean, the goal is to help you feel cared for in some way. And some of that is going to be kind of the treat yourself side, and some of it's just going to be the self-nourishing side. Like, what do I have to do to live my life as healthy as possible? Um, and I do just want to point out that for the vast majority of people, when life gets the most stressful is the exact time that we tend to give up on all of our self-care habits, right? How often has it been, we're on a really good streak with exercising or eating healthy, and then a big project pops up at work, and all of a sudden we're hitting up the McDonald's drive-through and we're going to bed without having hit our step goal for the day or whatever that looks like. So it's understandable and it's not helpful because those are the times when we need to implement some of these the most, right? When we need to be taking care of ourselves the most. So just be aware of that. And then these are just the big takeaways that I would hope you get out of this presentation. So stress is a natural part of life. Everything important to you is going to stress you out sometimes, right? And I'm going to say that again. Everything important to you is going to stress you out sometimes. So that means stress itself is not automatically a bad thing. Chronic stress may benefit from some intervention. So if you're noticing yourself feeling constantly stressed to the point where you're getting what we would call burnt out, you stop caring about things, you're exhausted all the time, you don't feel like anything you do is having any big impact, that's when you might want to seek out some help. So counselors, um, any kind of therapist, talking with your doctors about medication, even depending on your circumstances. Um, or talking to your oncology team about seeing one of our clinical psychology providers here to help get you through that. Um, you can reduce stress by either getting rid of the sources of stress or by giving yourself more internal resources, right? So you either make your life less stressful if you figure out a way to do that, or you give yourself more resources to cope with the stress of life. Um, And then I always like to end with stressing about stress is not going to help. That just adds to your stress. So that's a phenomenon we call dirty discomfort in the therapy world. So your clean discomfort are your natural reactions to events, right? You get cancer and you're scared and you're sad. Dirty discomfort is when you yell at yourself or stress yourself out about those natural reactions. So that's when you tell yourself, I shouldn't be scared. My doctors tell me I'm going to be fine, or I shouldn't feel sad, or I shouldn't feel this way. Like we said before, yelling at yourself and shoulding like that does not make things better. It makes you feel worse. So instead, kind of using those coping skills instead, or talking to someone in the mental health field if you feel like you need that extra help with it. All right. Um,
Thank
does
you very much for that presentation. If there are any questions, do please feel free to type into the chat, or you may unmute your microphone and ask directly.
All right. Well, thank you so much, everyone, for coming. I'm gonna stop the recording, hopefully. Let's see. Stop recording. Okay.